If there was no Neuroscience Institute, it would probably mean that I would have lived a life of pain and discomfort for the rest of my life, a very limited life.
Stroke, traumatic brain or spinal injury, Parkinson's disease, epilepsy, brain tumors, aneurysms, multiple sclerosis. Treatment of complex neurological conditions such as these requires an extraordinary depth and breadth of clinical expertise and multiple specialists. Maine Medical Center and private community-based physicians formed the Maine Medical Center Neuroscience Institute in 2007 to provide this treatment.
We realized that the hospital and our interests as a private practice group of neurosurgeons was best served, and the best means for us to provide the kind of care we wanted to provide was by collaborating.
The total care of the patient involves not simply dealing with their particular neurologic problem that they presented with. It involves the whole patient.
I think as people come together into more center-like institutions, the care becomes more coordinated and improves. There's more collaboration.
Part of the project was trying to standardize the care of the patients. Part of the project was trying to bring in new technology and new expertise and develop treatments that we didn't previously have in the institution.
It's very exciting. You put all that energy together from all these people that have kind of been in the trenches just doing their regular work, and let them start to get an idea of something bigger that can come from making this a program and giving it some structure and then working together.
So it's been kind of a chance for people to see what other people are doing, see what works, and see how we can all change for the better, for our own practices and for our patients especially.
Maine Medical Center has been utilizing sophisticated resources for the diagnosis and treatment of neurological disorders for decades. These resources have helped the hospital, its physicians, and other providers earn national recognition for their expert care in such areas as stroke, neurological care, neurosurgery, and neuropediatrics. With the establishment of the Neuroscience Institute, Maine Medical Center has taken its commitment to excellence to the next level.
In order to have a full-service neuroscience program, that you have to have outpatient as well as inpatient.
You need emergency medical services, the emergency department, the intensive care unit, the hospitalist system, and the people who take care of the patients when they leave the intensive care unit, and then rehab and nursing home. That's a bird's eye view that the Neuroscience Institute has.
To me, the thing that really differentiates an organization is when you start going from just delivering great clinical care to looking at investigating the processes that are causing these diseases and trying to find new ways to understand them and treat them.
Maine Medical Center is creating a center of excellence by building this comprehensive and coordinated system for delivering care. This system is based on proven clinical guidelines and integrates medical education and research in the neurosciences. Our ultimate goal is to ensure that we have the best possible patient outcomes, in addition to improving the quality of life for those living with a neurological disorder.
We really have managed to provide high-end care across a big spectrum. We really don't have to turn outside of this institution often to provide what I would consider to be world-class care.
My son was injured in a car accident on a very snowy day, and
he had a severe brain injury.
he was in such a state that he needed immediate attention from them.
I think I always believed that it was the right place for Henry.
They were on top of this.
I think he's doing okay.
Sometimes, like when I actually put myself back in like the early days and when he was coming out of his coma, it's like you can't even believe where he is now compared to that.
Overall, the experience was a very positive one. They're really capable people, and they brought all their experience and knowledge to bear here, and frankly, it saved my son's life.
I guess I look at most of the people I work with push themselves hard, not necessarily to compete against others, but sort of against themselves to be at the best level they could be. And now they want to, again, recapitulate that in the whole program that we build here. We want it to be the best.
The people here are, there's excellent level of expertise, and we can see that already we're attracting candidates who have even a higher level of expertise and expectations as well.
I think that Maine Medical Center has already defined itself as a major tertiary healthcare center, and it provides really exceptional quality care. And part of that is offering high-end neurosurgical care.
The message that I would try to send out to the community is really a message of hope that, that the advances that have been made in technology and in the quality of patient care are helping people with bad brain injuries.
The speed of my care, both in the emergency room, the ability to consult with neurologists, all contributed to my outcome.
We want to treat them, and we want to give them a chance.